Almost 7 million people are in need of urgent health assistance across northeastern Nigeria, Borno State being the worst affected. We talk about the crisis in northeastern Nigeria in terms of a food crisis, a malnutrition crisis, a water crisis, and it's all of these. But if you have a food crisis, if you have a malnutrition crisis, if you have a water crisis, you have a health crisis. WHO recently did a survey of over 700 health facilities, which showed that 60% were either partially damaged or completely destroyed. While some areas remain inaccessible, others are simply hard to reach. But this involves travel by helicopter, down dirt roads, through conflict-affected areas. Teams take incredible risks to reach people and provide vital healthcare.
This is one of bobblehead teams working here in Kaga. They comprises about 5 people. We have one LGA facilitator. We have the one person that is providing antenatal care to pregnant mothers. Then we have the other one that is giving routine immunization. Then we have the other one that is treating the minor elements, things like pneumonia, malaria. And in time of malaria, they used to do test first using the rapid diagnostic test. After doing the test, if the test positive, then they treat using ACTs.
With 24 mobile health teams in some of the most hard-to-reach areas, WHO, alongside the Ministry of Health, is one of the largest providers of healthcare to those displaced from their homes and to vulnerable children in some of the worst conflict-affected areas. With still almost 2 million people displaced from their homes, disease outbreak is potentially fatal to many of the most vulnerable people here. WHO has worked hard with the Ministry of Health to set up a surveillance system so that we can spot public health outbreaks and react to them quickly. Once diseases like measles, like cholera, like pneumonia take hold within crowded IDP camps where people are malnourished, they fall prey to them very quickly and they spread like wildfire. WHO is working to train hundreds of community volunteers looking at the 3 main killers of those under 5: malaria, pneumonia and diarrhea. People are taken from the community, they undergo 2-week intensive training course and they go back out and work in a community alongside the Ministry of Health. This is vital in order to provide healthcare in some of the areas where formal healthcare structures simply cannot reach.